Good evening and welcome to Doctors on Call. I'm Dr. Peter Nalin, Professor and Department Head of Family Medicine and Biobehavioral Health, Associate Dean for Rural Medicine, and co-leader of the Duluth campus of the University of Minnesota Medical School. I'm your host for our program tonight on ear, nose, and throat problems, including sleep apnea. The success of this program is very dependent on you, the viewer, so please call in your questions or email them to ask@wdsc.org. The telephone numbers can be found at the bottom of your screen. Our panelists this evening include Dr. Andrew Davis, an ear, nose, and throat specialist with St. Luke's Ear, Nose, and Throat Associates, and Dr. Jason Wall, a family medicine physician with Essentia Health and faculty member at the Duluth Family Medicine Residency Program. Our medical students answering the phones tonight are Jenny Fournier of Hermantown, Jace Leslie from Hibbing, and Sarah Rykoff from Duluth. And now on to tonight's program on ear, nose, and throat problems, including sleep apnea. And already, Dr. Wall, we have a question via email. If someone diagnosed with sleep apnea stops using the prescribed sleep machine, how might this affect their other chronic medical problems like diabetes, asthma, or reflux?
Thanks, Dr. Nalin. So originally, a lot of sleep apnea, we realized that people who have untreated sleep apnea have higher risk of uncontrolled blood pressure, heart disease, or diabetes. And so it really there are a lot of ramifications of, and we know that people struggle sometimes with getting used to it, or they fatigue of having to spend every night getting a machine set up. But the benefits are clear that you're going to have a healthier heart, better blood pressure, better control of your blood sugars, and certainly a more functional day from the enhanced sleep that you'll have from the machine use. And they've really come a long way with all of the different mechanisms to deliver that airflow to prevent the obstruction in your upper airway. I mean, there are nose pieces, there are face pieces, they're soft. There's a whole industry out there it's just keep working with us and we'll figure it out.
Thank you. And Dr. Davis, a related question. A patient with mild hypopnea could not tolerate the Cpap machine and its nasal cannula. Could allergies be part of this problem?
That's a very good question, and it's something I see in my practice a lot. The nose can definitely have an effect on patients' compliance with Cpap. There's a number of different treatments we can use, including some simple things like nasal steroids to help open up the nasal passages a little bit. But if there's an obstruction issue, there's surgical procedures we can do to help that as well. So,
we also have a surgical question. Are tonsillectomies less common, and what explains this trend?
It's something that we've seen, over the last 2 to 3 years with the COVID pandemic. Kids are in daycare less. Kids are in school less, so they're not getting the necessary 4 to 6 tonsillitis a year. So the overall tonsillectomies we've been doing has gone down significantly. And now I would say the most common reason we're doing tonsillectomies in kids is for obstructive sleep apnea. So,
interesting.
Yeah.
Dr. Wall, how do you interpret the locations of sinus pains?
So a sinus infection is one of those, it can be a mimic, and so sometimes people come to us and they say, oh, I have migraines, or I have, every time I put my head down, I have, something's wrong, because every time I put my head down, I have, pain behind my eyes. And so I think in the past, there used to be a lot more. We used to try to transilluminate, and of course, we're going to, get a good history. That's the first thing is, is it behind your right eye? Is it behind your nose? That'll, there are ethmoid sinuses, maxillary sinuses, frontal sinuses, basically four sets of sinuses. When it really comes down to it, if it's kind of deeper in the nose, we often need some advanced imaging to see, or we can ask our good colleague, Dr. Davis, to kind of take a look with with a fiber optic scope. But classically, there are some sinuses up in the forehead. Sinuses right below the eyes will be your maxillary, and then behind the nose or back deep, you have some ethmoid and sphenoid sinuses. So those can be a little trickier to diagnose, and certainly on the rarer end, but the location of the pain can kind of help. The treatment is largely going to be the same, but when it's ethmoid, we also get concerned about potentially some more rare conditions. Is there, are there some benign growths, or even could there be a cancerous growth that's kind of causing sinus pain because of its location within the skull? Pictures are ultimately going to be our best friend with cases that don't resolve immediately. So.
Speaking of imaging and diagnosis, Dr. Davis, how is it actually possible to pass a flexible scope in through the nose?
Well, fortunately, unfortunately, a lot of my patients have to experience this with me. We at ENT, we do flexible fiber optic laryngoscopies all the time. I'm doing probably about 10 to 15 a day. And depending on what the patient needs, sometimes they need a little bit of a local numbing medication inside their nose to kind of make it a little bit more tolerable. But most patients just are able, it's a quick exam, and most patients are able to tolerate it without too much problems. But I always tell patients it's kind of like getting a COVID test, but I can actually see where I'm going. So,
Thank you. And Dr. Wall, do you encounter mononucleosis, that is mono, in your practice, and how does it relate to ear, nose, and throat?
It's been quite some time since I've seen mono. It's out there. I can't speak from an epidemiologic standpoint why there's maybe less of it right now. It's certainly out there. We have rapid tests for it, and how it could, certainly one of the hallmark symptoms of mononucleosis is going to be fatigue associated with significant lymphadenopathy, which translates to swollen lymph nodes. And so you can get a lot of lymph node swelling. You can also get swelling of your liver, but that's going to really affect your breathing, and it's going to lead to potentially uncomfortable eating, more difficulty, snoring would be a classic symptom. And I think, from a family medicine perspective, I don't immediately go to it being an ear, nose, and throat concern. I'm much more concerned about if somebody's diagnosed with mono and they're a young person and they're active, I'm worried about just keeping their spleen. I don't want them to, because your spleen can swell when you have mono, and if you're playing football, hockey, you accidentally, that spleen is swollen and you accidentally fall, say just even slipping on the ice, it can be kind of a, you can bleed a lot when your spleen is damaged. So that's not related to ENT, but certainly you could expect to have some upper airway, all the lymph nodes in your tonsillar tissue and in your neck could be quite swollen, and that should get better, but it's going to be weeks, not days.
Okay, thank you. Dr. Davis, back to the nose, what is a deviated septum, and is it natural or traumatic?
So it can be both. No one's septum is truly straight. I mean, it's babies are born with deviated septums, but the majority of them are usually traumatic, and the majority of them are usually benign. They usually don't cause any problems. Just because you have a deviated septum doesn't necessarily mean that you have, obstruction of breathing or any difficulties breathing. But it's the patients come to see me when it gets to the point where, they're doing their sports activities or their daily activities, and they're noticing that it's more difficulty to get airflow in through the nose. So it can be a natural thing, but also can be a traumatic thing as well.
Thank you. Dr. Wall, can allergic rhinitis occur in the winter?
Certainly. There are perhaps more insidious allergens that cause, because especially in this recent weather, 20 below, whether you're burning wood in your house, so wood smoke, more pet dander, you don't really have your windows open when it's 20 below out. And so all of the environmental allergens that are normally occurring in our house, pet dander, wood smoke, cooking, fumes, they're all going to be concentrated in the winter. And so it's not a luxury everyone has, but if you have the option of an air exchanger in your house that can bring clean air in, and there are certainly ways, if you suffer from allergies, talking to about a way to make sure that you're moving fresh air into your house. And of course, continuing the prescribed treatment. Nasal steroids, as Dr. Davis mentioned, are really the backbone of treating all of those environmental, whether it's a seasonal allergy in the spring or the fall, or an environmental allergy. Of course, there are some very specific allergies to like certain, I know in certain certain living environments there can be like dander or feces from mice and other things. Some people develop very specific allergy, and we do have some very specific medications for those. But that you would see a specialist, and they would diagnose your specific allergy. By and large, most of the winter allergies are due to the pet dander and the particulates in the air and so those are treated with the nasal steroid.
Thank you. Dr. Davis, a caller asks, which one is better, oral appliance or Cpap in the treatment of sleep apnea?
That's a great question. The gold standard treatment for sleep apnea is always going to be Cpap. There's no question about it. Now, oral appliances are very effective and can be as good as Cpap in certain patients, but if the tried and true method to treat sleep apnea is always going to be Cpap.
Thank you. And Dr. Wall, a viewer asks, is melatonin safe and does it work for sleep issues?
Excellent question. Melatonin is generally regarded as safe. However, if used improperly, melatonin released by the pineal gland in the brain is part of our circadian rhythm. People will use melatonin to help reset their sleep-wake cycle if they were to take an overnight flight to, say, across to Europe. The thought would be that when you take melatonin, you're setting your body up, you're telling your body to sleep. So using it at the wrong time or in excess amounts can disrupt that. But in theory, melatonin should, it's just, my experience is sleep, if you'll allow me, it's kind of like a lot of things, it really depends. If you have a lot of stress in your life, if you are a 4-pot-a-day coffee drinker and you're drinking coffee well into the afternoon, if you're taking medications that are stimulants, such as for attention deficit hyperactivity disorder, using another medication to help you sleep might only be part of the solution. And so I think for somebody who's having trouble sleeping, there's a whole area of sleep hygiene, which means, avoiding bright screens, going through the same routine every night, making sure that your room is cool, you've not had stimulants, your nicotine is another stimulant. So there are any number of things that you want to make sure are not preventing you from sleeping, and then moving to a medication like melatonin would be a good next option.
Thank you. Dr. Davis, a parent asks, will my child's eardrums heal completely after the ear tubes fall out?
This is a common question I get, and part of the kind of the informed consent process with myringotomy and tubes or putting ear tubes in. 95% of the time they do, 5% they don't. In that 5%, a lot of times we can do small little procedures that don't have to have eardrum reconstruction or anything like that, but we can kind of get them to close on their own. But about 5% of kids tend to hold on to those holes, and we have to do things when they get a little bit older to make those holes close.
Okay, thank you. Yep. Dr. Wall, do sinus cleaning machines really work? A caller from Superior asks.
fascinating question. Certainly, if you go into the sinus aisle at your local pharmacy, you're going to see a number of nasal rinses and spray bottles. And so I'm not sure that, I'd have to know the exact details of the machine. Certainly, many people all over the world do irrigate their sinuses. People may be familiar with the neti pot. That's another way of irrigating your sinuses. Certainly, using a saline solution, the salt draw is a mucolytic agent, meaning it loosens all the mucus and breaks it down in the sinuses and allows it to be flushed out. And so people that have some anatomic deformities to their sinuses, excess mucus production, or irritated mucosal, meaning the lining of the sinuses, that tissue lining the sinuses, can all benefit from rinsing and using a machine that's going to rinse, or just simply using like a neti pot that will irrigate their sinuses. Now, with that said, it's also useful in seasonal allergies. You can wash the pollen and the allergens out of your sinuses too. So, Dr. Davis, you might have some additional insights.
Yeah, I mean, I think it's extremely important in terms of sinusitis and chronic allergy treatment. I mean, it's my reflexive thing I put my patients on is saline rinses at least twice a day, Flonase or nasal steroids, and then depending on what the issue is, other treatments. But almost all my allergy patients get at least saline irrigation, so a neti pot or else nasal steroids.
Also, Dr. Davis, a viewer describes having had Meniere's disease, and now the jaw moves and sounds like a clicking keyboard in the ear. What might be causing that?
Well, I sympathize with you for your Meniere's disease. That is one of the toughest diagnoses we can give to vertigo patients. It's a very trying diagnosis. Jaw clicking can be kind of a widespread, complicated thing. The majority of jaw clicking is secondary to temporal mandibular joint disorder, or TMJ for short, which can cause kind of localized jaw pain, clicking, and soreness. So that's usually what it is, but if it's causing you significant symptoms, I definitely recommend going to your local ENT or your primary care provider.
Dr. Wall, another question about sleep apnea. Is it true that losing weight can help sleep apnea?
Yes. Weight loss is one of the, it's the probably most effective ways, short of Cpap. Cpap you'll notice immediate benefit, and weight loss will amplify that benefit.
Okay. And is sleep apnea hereditary?
I don't know the answer to that. My guess is yes, absolutely. I think we all have the architecture of our hypopharynx, the back of our throat, is going to be genetically influenced. And some people just have necks that are shorter, stouter, and when we, and with the amount of tissue that you have in the back of your throat, when you fall asleep, it relaxes and it can fall over your airway and occlude the airflow into your lungs. And so I think there's certainly a genetic component to that. Yeah.
I would agree. There's definitely a genetic predisposition to it.
Dr. Davis, we're getting two questions about tinnitus, ringing in the ears. One is, what can treat it, and are medications involved?
Tinnitus is a really difficult problem. Millions and millions and millions of people across the country struggle with tinnitus, and kind of how I describe it to patients is kind of the brain's understanding or the brain's feedback to their hearing loss. So tinnitus is usually caused from hearing loss. How to treat it? That is a extremely difficult problem that the FDA and many different groups across the country have put millions and millions of dollars into. That, to be honest, we don't really have an effective treatment. So what I usually tell patients to do is masking treatments, meaning have a fan on in the background, have the radio on in the background to kind of dumb down the noise. If it bothers you at night, to have a noisemaker on, a shusher, what you can get in the baby aisle, to kind of help bring down that tinnitus. If you Google tinnitus, there's a million different treatments out there. There's a million different medications. None of them are recommended by the ENT groups, and I would talk to your primary care doctor or your local ENT before starting any of the treatments.
Okay. And a quick follow-up question, Dr. Wall. Could receiving a vaccine lead to tinnitus?
I'm not aware of any particular vaccines where it is certainly of the hundreds of millions of vaccines, there's a whole reporting system for adverse events. It's not a common side effect or even a rare side effect of any vaccine.
Okay. And a question from Duluth, Dr. Davis. Is removing tonsils from a 28-year-old more difficult, and how long is the recovery?
Now that's a great question. It's not technically more difficult. The surgery takes about the same amount of time. It is a much more difficult on the patient post-operatively compared to kids. And we don't really know why. It's probably because the tonsils are more scarred in. They've had 28 years of infections and just chronic scar tissue. I tell patients to expect at least 2 weeks of significant pain post-operatively, and the major side effect of tonsillectomies that we worry about is post-operative bleeding, and that can go up to 5 to 10%. So you really need to have a thorough discussion with your local ENT if that's something that you want to go under.
Thank you. Dr. Wall, a viewer from Duluth is suffering from post-nasal drip that leads to sneezing. Why is that?
So mucus, there's an irritant or mucus is coming from your sinuses and draining down the back of your throat and stimulating some of either the receptors in the back of your throat or further down that are causing you to gag or sneeze. And so the treatment for that would be to decrease the flow of mucus, and the best way we have of doing that is with a nasal steroid. Doesn't happen right away, but the inflamed tissue stops secreting so much mucus, and then you slow down the nasal drip.
Dr. Davis, what is a Schotsky ring and what causes it?
So Schotsky's ring, it's a kind of a concentric area of scar tissue in the esophagus that causes patients to have pretty significant swallowing issues. I mean, you can have really bad regurgitation, and you can get food completely stuck in your esophagus where you really struggle to get it up. Now, the main cause usually is chronic reflux or chronic irritation, but there's other things such as trauma and things that can cause it too, but reflux would be the main issue there.
Okay. And Dr. Wall, a quick question. A caller has seen a patch worn for sleep apnea. What is that?
Boy, I'm not familiar with the patch.
I personally don't know what a patch for sleep apnea.
Yeah.
Okay. And Dr. Davis, a brief question. What's a common imaging test you order, and how does it help you?
I mean, the thoroughbred of imaging for ENT is a CT scan. So we get CT scans for neck masses, for sinuses, for a number of different things. So CT is my go-to.
Okay, thank you.
Yep.
And Dr. Wall, a patient calls about a clicking and discomfort in the jaw hinge while chewing. What might lead to it, or what might help?
Certainly, as Dr. Davis mentioned earlier, temporal mandibular joint dysfunction, otherwise known as TMJ syndrome, involves where the jawbone articulates with the skull. And sometimes it's genetic, sometimes simply wear and tear. Lots of times it's due to trauma or poor, over the years, bite. People grind, bruxism, grinding your teeth at night. People aren't even aware of it, and they're putting tremendous force on those joints in their jaw, and it can lead to breakdown of the cartilage and a clicking. and when they go to open their mouth to eat or chew, they'll notice a popping and clicking. And so I think the second part is what can be done about it. There are whole clinics and to try to, we have medications, we have injections. A lot of it has to do with making sure that we address the reason that led to the damage in the joint in the first place. Lots of times that's clenching the teeth at night too, so sometimes seeing a dentist or making sure you have the right protection for your jaw and your teeth at night too. Dr. Davis, you may have some other...
No, I agree with those points.
Very good. Well, this has been a most illuminating set of questions that have come in quite briskly from our callers and viewers, and really appreciate your time and attention in answering them, both of you. Thank you.
Thank you.
Well, I want to thank our panelists, Dr. Andrew Davis and Dr. Jason Wall, and our medical student volunteers, Jenny Fournier, Jace Leslie, and Sarah Rykoff. Please join Mary Owen next week for a program on lower GI problems when her panelists will be Dr. Robert Erickson and Dr. Stephanie Judd Irwin. Thank you for watching. Good night.